Hi, everyone. It's so awesome to be at the SUSA Summit Online. I'm so excited to be hosting this important conversation around exponential therapy, how psychedelic drugs and tech are reshaping the world of mental health. We've got an all-star lineup in our panel, and I think the first order of business would be to go around the room and see who's here to chat with us today. So I'm going to start off with Chaim Racklaw, the founder or the CEO of Psychedelic. Want to tell us a bit about yourself?
Sure. Thank you, Ronen. Yes, I am co-founder and CEO of Psychedelic. I came to this after 24 years in biotechnology. And I came to this because of the opportunity to do well and do good and demonstrate that that's possible is unprecedented in the realm of psychedelics. Psytech operates three business arms, the Psytech Summits and master classes and webinars. So the creation of community focused on clinical care, leveraging psychedelics. We operate a clinic chain in the United States, and we produce a clinical tool to aid clinicians in the delivery of psychedelic-assisted therapies. And I should also share with your audience that as of yesterday, we have officially become part of the Wisana Health family of companies.
Awesome. Jody, what about you?
Yeah, good afternoon. Greetings from a beautiful and sunny Cape Town. Wonderful to be here. Thanks for having me. I'm actually a chartered accountant by profession, but my background has been in private equity. And I am one of the founders of Science. Science is a listed company. We are a licensed psilocybin cultivation operation. So we produce certified psilocybin, and we are also working in clinical research. And we are looking at the use of psychedelics in palliative care. That's our focus. And we've recently launched a functional mushroom range in South Africa called Good Mind. But I guess the first thing to say is I'm not an expert in psychedelics. I've only been working in the sector for about 5 years now. So I'm still learning every day. And the sector is in its infancy. And each day that passes, I'm learning new things. And I still have a long way to go. But that's what's beautiful about the sector. And it's exciting. And in some ways, we 4x4 and we're the lead vehicle. And sometimes you do hit some obstacles. But an exciting sector, a sector that's going to have a massive impact on humanity. And I certainly believe that post-COVID, there is a new pandemic in mental wellness. And that's why I'm working in it and helping build the sector.
That's so awesome. It's great to have you on board. Simeon, where do we find you?
You find me in beautiful and ancient Kotor, Montenegro at this moment.
Awesome. Tell us about yourself.
Yeah, no, I'd love to. And great to be on such an esteemed panel with some great leaders. On psychedelics, I've been involved in the space since I could remember. I think my first kind of realization, epiphany, when I was just a young teenager and had the opportunity to study with Robert Masters and Gene Houston, who wrote a pivotal, seminal book called Varieties of Psychedelic Experiences, and just was hooked at that moment. Along the way, participated in advocacy and philanthropy and protocol development and tech. Opened the world's first psychedelic art gallery and medical marijuana dispensary in 2008. And find myself right now sitting at the intersection of really amazing companies and really great capital market opportunities as a founding member and managing partner of JLS, a venture capital fund strictly focused on the psychedelic space. So great to meet you all. Great to be here, guys.
Awesome. So I think to kick things off, there should be the first question, because most people in the audience will be thinking, what are psychedelics? There's been a lot of talk about psychedelics, but there's still a lot of stigma around it too. People have some firm views. There's been decades long of anti-drugs and a huge amount of propaganda. that has taken place since the 70s. And now we're seeing psychedelics in every mass media publication. Wherever you look, people are talking about psychedelics. But what are we actually talking about when we're using psychedelics in the form of healing mental health conditions? And Chaim, maybe you want to have a shot at it, just around what are these compounds and what is the stigma around it?
Thank you, Ronen. I think I'd like to address the latter half of that question, and I'd actually like to hear Simeon's answer to the first half of the question, which is the definition of psychedelics. I mean, there's the nomenclature, which is there's an interesting story around the word psychedelics, but I'd just like to focus on the second half, which is the clinical utility. Because as was mentioned right after my introduction, we're dealing with an unprecedented time in human history in terms of mental pathology. We tend not to use epidemiological terms around mental health because it's not transmitted the same way viruses are, and now everybody's familiar with the way pandemics work. But if you just look at the numbers, the rates and the escalation of those rates of depression, of post-traumatic stress disorder, of anxiety disorders, of substance abuse disorders, we are in an epidemic, fundamentally. And what we have with the class of molecules known as psychedelics seems to be an unprecedented breakthrough in mental health care. And those superlatives actually apply to psychedelics well. And the reason I say that is the studies that have been done by unimpeachable institutions like Johns Hopkins and New York University and Imperial College of London and Maastricht and Leiden, the list goes on. And over and over and over and over, when the clinical use of psychedelics, meaning with the right set and setting, with the proper screening, with the proper preparation of intention, and the proper integration post use of the molecules is done, the clinical results are absolutely unprecedented. They're astonishing. So in the case of PTSD, there's an aggregate of 6 studies that was done. This is one example, and there's plenty more with other molecules and issues like depression and addiction and anxiety. But with PTSD, you had more than half the participants in an aggregate of 6 studies no longer even registering on the symptomology scale of PTSD. Just think about the implications of that for the world. There's no therapy right now that even comes close to that kind of clinical efficacy. And after having been in healthcare for more than 2 decades, you do not see this often. So I'll stop there.
You probably don't see it at all. I mean, even if you look at the mental health picture.
Maybe when penicillin came out, there was penicillin with bacterial infection was pretty potent. But yeah, in terms of healthcare, no, I think this is unprecedented.
Yeah. So Simeon, why don't you tell us, when we talk about psychedelic compounds, what are we talking about?
Yeah, we're talking about primarily classical psychedelics. I think there was also an embedded question about what does psychedelics mean, and actually, the direct denotion is mind manifesting, and it was first coined by a dude named Humphrey Osmond, a British psychiatrist in the 50s who was working out of Canada, and it was penned, I believe, in a letter to Aldous Huxley, something along the lines of, to fathom hell or soar angelic, just take a pinch of psychedelic. So that's a little of the history of the origin of how and when the word became popular. As far as the molecules, there's dozens of classical psychedelics. Most people are familiar with psilocybin and psilocin, which naturally comes from magic mushrooms. There's LSD. There's the 2C family. There's a couple of others that are on the border. You can have a psychedelic experience. So you'd hear ketamine, you'd hear hape, you'd hear others, but dozens of psychedelics. And just to riff off of what Chaim said, yeah, some of the data that's coming out is really profound, but there was also tens of thousands of trials that happened and kind of all stopped in their tracks. I mean, not 100%, but kind of stopped in their tracks in the early 70s with the Controlled Substances Act. So not only is there great new data coming out, but there's amazing data from clinical trials previous to the Controlled Substances Act, and even greater data from several indigenous cultures who've been using quote unquote medicine in tribal contexts since probably the beginning of our species. So that was a very long answer, but that's my view of psychedelics.
Yeah, so thank you very much. And I think it's worth noting to the audience that although you live in the US, you've got strong ties and roots in Africa. And maybe you want to tell us maybe a bit about your experience, especially along the lines of Iboga, which is legal in South Africa and is really used in ritual ceremonies and is very powerful when treating addictions, etc.
That was a question to me, correct?
Correct.
Oh, I'm sorry. Sorry. Because Jody, I know, is sitting in South Africa. But no, my experience in Africa was primarily West. I lived there for a couple of years in Ghana, but got to travel around. So saw some of the early protocols around ibogaine or iboga, which came from Gabon primarily, from the Tabernathi bush. And it was used as a rite of passage and still is. But also, it's this amazing natural medicine that, from what I've seen, is the closest thing to a silver bullet around detox and withdrawal of opiates and other substance use disorders. So that's a little about Iboga and a little about my history in Africa, but also a little South Africa. But really, West Africa is where I lived and had a chance to, hang out in, jungle forest cultures and kind of witness miracles on a weekend basis when I got away.
Awesome. So I think let's move on to what the future of therapy looks like. But before we get there, I think it would be interesting to hear from the panel what made you so interested about getting into the space. And I think we'll start with Jody.
For me, I've worked in private equity, in property, in hospitality, in online businesses, 17 different businesses actually over the last 30 years. But now I want to make a difference. And psychedelics can have such a positive impact on humanity that I can't ignore it. So I have decided to dedicate the rest of my business career to focusing on impacting humanity, and I can do that with psychedelics. So really exciting for me.
That's awesome. Chaim?
Sure. Three reasons I'm here. This is what I've said. I've said since I joined this industry. Personal, professional, and opportunistic. So the opportunistic is that I because all the superlatives that we mentioned actually apply to psychedelics, it's a rare opportunity, and in some ways, as Simeon cited earlier, it's been a man-made opportunity because so much pent-up research has been held back for almost 5 decades, and it's being unleashed now. So I think it's a rare moment in the business space. That's the opportunistic. The professional is I see an opportunity. Like I also spent about a decade in Africa. I used to work in infectious disease diagnostics, and that's where I first encountered the opportunity to, in a very real sense, do well and do good, and demonstrate that that's not only plausible but the way we should operate. And personally, I was intellectually stimulated. You can't not be when you read these studies, but I was personally moved by what I read. I'm the child of 2 refugee immigrants that came to the United States. One side came out of Stalinist gulags, the other side came out of Nazi camps. I grew up in Philadelphia in the 70s and 80s, so you saw the trauma of living in an American city that includes large parts of it that are ravaged. I worked in Africa, and where you see intermingled both beauty and real plight. So when I encountered the opportunity to work in this sector, nothing was going to stop me.
Cool. Simon, do you have anything to add?
Yeah, the question of why am I in the into psychedelics? My answer is probably short and succinct, but I've always loved drugs and money.
And you looked at part two.
Or you
I
can
think we all
say,
gonna
you
say
know, consciousness, mental health indications, and early stage entrepreneurship and capital markets. Or you can say drugs and money.
Got it.
We're all drug dealers. We're just working in the right decade.
Set and setting. So as someone who's had a few seasons of therapy and with some limited success, in all honesty, I've been on and off medication for years in my life around anti-anxiety medication, and all kind of saw myself as a loosely stitched, high-performing individual. And after many years, I thought, well, this medication isn't really helping anything. And that's what actually led me to go down this road to seek alternative ways to look at mental health. And so while I don't have any grudge with therapy, I'm just thinking what the future of therapy looks like. And I wonder who wants to have a shot at it first. So what is therapy going to look like in 2 years' time, in 5 years' time, with regards to both substance, the therapy, and the technology? Who would like to go first?
The worldwide significant investment into new research in psychedelics, coupled with a huge body of evidence from the 50s and 60s, is really going to lead us to a future where psychedelic medicine will once again be accepted as a legal, clinically proven alternative to the current, what I believe, inadequate treatment of mental health illnesses is. So the key word for me here is acceptance. That's what the future will look like.
Filling in the middle on the question of how will therapies evolve. I think it'll be interesting. One of my favorite quotes this year was from a really special researcher who made a comment that the PTSD that patients will have from AI-assisted psychotherapy will require even more humans to get trained in psychotherapy and psychedelic-assisted psychotherapy. So I think, in kind of tying in singularity, I think there's going to be some very interesting things happening in the next decade as technology is enhancing and affording and accelerating certain modalities that we used to do without tech. So it's something we're watching very closely, of course. But yeah, I mean, today, right now, therapy, there's going to be a bottleneck and a lot of opportunities to train more and really understand the protocols and the therapeutic approaches for each indication, which might have one or many different psychedelic molecules. So very fun, interesting times to see how it's going to evolve and exactly when.
it's hard to pin down the timing, but in medical terms, immediate, proximal now, because we're debating between first quarter of 2023 for MDMA or second or third quarter of 2020. That is nothing in terms of novel therapeutics. So it's all happening immediately, and that's what we're setting up to do. So in my space, it's going to be about the refining of the protocols, because playing off of what Jody said, acceptance is in a large way here. Every event we do, the product inquiries we have, it's from leading psychiatrists. Like the acceptance is there. Latest polls in America, in the United States, better than 65% of people would take psychedelics if prescribed by their doctor as therapy. So we're racing in that direction. To maintain that, is going to make sure there's not bad outcomes, and these are handled responsibly, and the focus is on wellness. And that's about protocols. I also know enough to know that the reality is that the protocols that are used in research, when they meet the reality of forgive the American turn of phrase, but the commercialization of clinical care, they will change. So there's going to be an evolution in clinical protocols, and we need to, as a community as a community, both business, researchers, academicians, we need to be responsible, and we need to make sure that we do it well. And that's what our clinics are dedicated to do. And from a technical side, we're working with the people creating the protocols to ensure that the best practices are delivered and adhered to.
And of course, we're all working in a regulatory environment worldwide. Yeah. And we must be cognizant of that. Regulatory bodies take time to change, and we all hope it will happen quickly, and we're working very hard on that. But I caution that it may take some time.
So if I had to put it very simply, if I'm an end user, if I'm a consumer, that Chaim, you're saying that, say, within 2 years, I will be able to go to my psychiatrist or to a therapist who's trained in a way to work with a psychedelic substance, and I'll be able to go for an assisted session. So they would sit in a session where one would have a legal substance, and post that there'll be therapy sessions after that with what comes out. And on top of that, there'll be technology that will not only assist the therapist, but will assist me as a patient too, to kind of really objectify and measure the results from that assisted session onwards.
The first part of your statement is geography dependent, of course. So, Canada has already cleared the way for psilocybin use for compassionate care, and that is the thin end of a very wide wedge in that space. In U.S. states, psilocybin is becoming legal for therapeutic use, not just decriminalized. Ketamine is legal across the country in an off-label capacity, but you already have several states that are covering it with insurance. MDMA, Q1 of 2023, it'll come out of the FDA. So the answer in short is yes, but it's going to be a cascade of legalizations that's geographically dependent. The second part of your statement, 100%. Everywhere. I think the responsible people who are going to be delivering care are going to be doing so utilizing good tools, not just for themselves to adhere to protocol or get the best guidance on best practices, but also so that that data is pooled for use by the broader community. We're not doing this in the 50s, we're doing this in the 21st century. So we have an opportunity from day one to do it in a way where data is captured and used to the benefit of all.
Awesome. My next question, I'm going to start with you, Simeon, is there's been triple-digit return in this nascent psychedelic industry, and there has been lots of money pouring in. Where do you think the opportunity is going to be over the next 2 to 3 years in this industry? Which part of psychedelics do you think would probably produce the biggest returns, or what's the most interesting side of the sector for you and the fund?
Yeah, I would be remiss without starting with the two gentlemen and their companies to the right and left of me. But beyond these two companies, which I would gather will have quadruple returns in short order, it's really a vast and multivariant ecosystem. I mean, we're seeing different trajectories at different levels, from the training of psychotherapists to the drug discovery and the development, to virtual reality, to brain to computer interface, to even in CRISPR. There's so much now under this ecosystem of psychedelics, with each one having different inflection points for returns, if you will. But certainly in the next year, a lot of the early stage companies that have IP. I mean, again, you really have this perfect storm of legislation and the people's voice with decrim, the data coming out of institutions and universities, and in our view, fuel on the fire, which is, the money, the capital market. So That's a question I can answer over many, many hours, and certainly will change from year to year to year. But did that answer your question?
Absolutely. So, Chaim and Jody, I'm going to give you an opportunity to give me one reason you're so excited about your own company, and then we're going to end off with that. Chaim,
Sure,
why don't you?
please. Oh, okay.
Sure, I'll kick off. Very excited. We federally licensed. We up and running. We out the ground. We had full-scale production. We exporting. We've learned a lot, and we're not at the starting block. We're in the race. So very exciting times. And really, just to end off, I'd like to just say in Africa we have a saying: if you want to go fast, go alone. But if you want to go far, go together. So I urge us all to work together as we change and develop this industry for the benefit of all.
Amazing. Thank you. Chaim, take us home. We have 30 seconds.
Could not agree more with Jody's last sentiment about the team. I met remarkable people in this industry for Psytech and for Wisana. I'm very excited about the future of this company because we are leading by example, not just the application of psychedelics for therapy, but the integration of psychedelics into mainstream psychiatry. And that's what we're doing with our clinic chain, and that's the purpose behind our technology, and that's what Wisana is doing with their drug development pipeline and the really exciting research happening at Brainstorm.
Awesome. And with that brings the end to this historical conversation on the future of therapy and psychedelic drugs and tech. Thank you, everyone, for joining us.
Thank you, Ronan.
Thank you so much.